All right, so this is just the thing one normally doesn't do, which is start a live stream with a new laptop and recently installed software and everything completely new. But, here we go. What can I say? I like to live on the edge. So it kind of looks like it's working just like it used to on the old laptop. I got me in the corner. I've got a website in the main. So I'm just going to hope we're working. Drop something in the chat if you can hear me. But yeah, I put this online so late, so recently that I'm not sure I'm going to actually get any viewers because no one's going to know what's happening. Anyway, if you do hear me, put it in chat. But YouTube Studio tells me I'm live, so here we go. We'll just hope. I'm Greg Farrar. This is my used to be daily live stream. It's probably been 2 weeks since I did it last, 3 weeks. So much for daily, but here I am again. It's the COVID-19 trends live stream, so I'll cover the trends at the countries of the world level in the first segment, then at the states of the United States level, and then counties of California, where I am right now. California is hot. From a COVID perspective, things are not looking good in California. So we may spend a little more time looking at California than usual. And also the United States is hot. Things are looking quite bad in terms of total numbers for the United States. So I don't know, maybe it'll just be a long one. Let's just start with the countries though. This may last an hour. I always want to make it last 45 minutes, but it really lasts an hour. So let's just be honest. It'll last an hour. If we look at the countries, the severity graph. So again, the severity is DCPM times the weekly growth ratio, which is to say it combines the daily cases per million, which is the population adjusted COVID cases, with the rate at which those daily cases are growing. And so this is my own special metric, an attempt to just in a single number, in a single graph, say how bad is it. And these can be compared across regions. They're adjusted for population. So you can compare, for instance, Turkey with, Santa Cruz County, California. These numbers kind of mean the same wherever they are. Roughly speaking, 200 is a bad number. That's severe. Maybe 400 is severe. And as you can see here, our scale is in the thousands. So there's just a lot of badness going around. Well, probably shouldn't zoom in quite yet. So Turkey. Usually when we see something like this, I take it with a grain of salt. 12,000 severity, remember 200 is bad, is so extreme that I don't really quite believe it. It could be a data anomaly. It could be that there's been some new cases that have been trickling in. Maybe they weren't reporting them for a while and then they threw them all in one day. That can happen. So let's not be too alarmed about this spike here. Let's just imagine for the moment that Turkey is probably just really, really bad, not monstrously bad, and is in the range that we've seen in recent days, the 2,000 to 3,000 range. That's terrible. Anything over, again, 400 is pretty bad. Anything over 1,000, it's not unprecedented. We had Qatar and Bahrain back in the early part of this year, which were in that range, severity-wise, a couple thousand. You can see even recently we had Slovenia and Switzerland as Europe got its terrible wave from which it's sort of recovering. We saw that those were also in the range. So usually there's a country or two in the range of thousands, but it's certainly not a good thing. It means that either there are a tremendously large number of cases or there's a very high growth rate, or both. Something like this is probably both. So if we look at this, being in the United States, I do certainly tend to focus on the United States quite a bit. I'll flash the United States thing here, and you can see the United States is in the middle of, or maybe the upper end of this pack of the hardest hit countries of the world. All the countries in the world, here's the United States. This is in order by severity. United States is, what's that, eighth? United States is eighth in the world. We have a trend certainly here, a geographic trend. Those of you who've been watching me for months and months and months know that we had the early cases in Asia, and then we had cases, sort of a wave of sorts in Asia, China and South Korea and other places in that area, and then it moved to Europe, where we had what seemed like a very big wave at the time, Italy, Spain, and much of Western Europe. And then it moved to the United States, and especially to South America. And South America was the epicenter for a while. But if you look at these now, the top ones, the trend is roughly Eastern Europe. Very roughly. There's Eastern Europe, Balkans, maybe a little bit of that, Central Europe, but we don't see Italy here. We don't see Spain here. We do see the UK. The UK is following along with the United States, as they tend to move kind of together, which is a little odd, but maybe not. And we do see Switzerland, the Netherlands, and Denmark, and a few of the other Western European countries. But what I really see here, a lot of Slovenia, Slovakia, Croatia, Georgia, even the Balkan or the Republic, not the state, not the United States of Georgia, but the country of Georgia, which I keep intending to look this up. My geography is not super strong, but was it a former USSR republic? Maybe. Certainly it's in the area of the Balkans. Is it a Balkan? I don't know. I'll just admit my ignorance there and try to look it up for next time. But generally it's east of Europe, in the area of the Balkans. And so that seems to be the center of the epicenter right now, that and the United States. But the United States isn't dominating as the epicenter, as it sometimes has. It's kind of in the middle, and there are a lot of countries that are worse. Nevertheless, here we are, the United States, number 8. Congratulations. This graph showing, I think this is the graph that was broken last time. I actually went and put some more time into this website. The website, by the way, is gregfarrar.us. I'm Greg Farrar, and you can go there anytime. These graphs are updated daily. You can get all these reports yourself if you want to zoom in. So if it's really Burkina Faso that floats your boat, you should be able to double click it. There's the information. Not very many cases in Burkina Faso, but all the countries of the world should be there, and so you can zoom in on wherever that great grandmother lived and see how the cases are there. All right, I'm mostly going to ignore the blue ones. The blue ones graphs, those are the old style graphs from back when I started this in February or so, March. Those are the graphs that I've been moving away from anyway, and I guess they're feeling neglected or something because they've just stopped working, which is fine because we're not using them anyway. So if we look now at one of the components of severity, so we started with severity, who's really got it bad? Again, that combines the number of cases per day adjusted for population, therefore DCPM, daily cases per million, major metric I use. That's one component of severity. The other is the growth rate. How quickly are the cases growing? How if we have twice as many cases today as last week, that's a weekly growth rate of 100%, and that gets factored into the severity. But we can break it down separately and see how are things looking for the top 20 just in terms of cases, daily cases, adjusted for population, so we can compare countries. And for that matter, we can compare countries to states or the United States, or we can compare countries to counties. All these numbers are on the same scale, daily cases per million. And this is certainly not a good graph. 200 daily cases per million is what, for the entire duration of this time, I've been calling a hot spot. It's a hot spot if it's over 200. And you can see that the top 20 countries of the world are all well over 200. In fact, they're mostly over 400. So we do have a whole lot of cases here in a whole lot of places. That's a little poem for you. But on the bright side, if I squint at this, I would say, I don't know that I could say that most of them are dropping in cases, but many of them are. You look, for instance, at Slovenia. Used to be at 800 daily cases per million, now it's 700. That's still really high, but better. Or you look at the one of the worst ones, Georgia, the country, used to be at almost 1,200, ridiculous, 1,200, now down to 900, also ridiculous, but lower than 1,200. So I guess that's good, but it's only just started happening. The overall trend of this graph is certainly upwards. In October, we didn't have any hotspots among these 20 at least. There may have been some other countries. We could look at this graph, for instance, to see. Oh, hey, hi, Dari. Looks like I'm live. Looks like I'm live with a couple of viewers, people who managed to rush as soon as I said I was online. Welcome. So good. That means that suggests my new laptop is working. So here are all the countries. This is a terrible snarl. Worth noting, though, that most countries are below 200. There's just a whole lot of them in the 100 range. So there are a lot of countries that are doing okay. But then there are also quite a lot, not the majority, but maybe this is a third of them or something. It gets spread out, so it's a much wider range, but I do believe that these rows here are far fewer rows than these here, these lines here. And among all countries, the trend certainly is that we have a lot more really high DCPM countries compared to September or August, where there were just a handful of hotspots. Now we've got a whole mess of them. But if we look at it, we still do see places like Serbia, and as we saw, like Croatia, or did we see Croatia? I don't know if we saw Croatia, but the worst ones, with the obvious exception of Lithuania, are dropping in recent days. Lithuania just keeps going. Is Lithuania in the top 20? I would expect it to be. With that graph, yeah, number 3, Lithuania really stands out as a country that's just going up and up and up. Let's look at the United States. Also stands out as a country that's going up and up and up, not quite at the frenetic pace of Lithuania, and there is definitely a sense of a slight slowing here. Around Thanksgiving, we were starting to see an actual peak, and then there was Thanksgiving. In the last live stream, I talked a lot about the various pressures on this graph, that Thanksgiving is going to be pushing us upwards in the United States towards more cases, because people will spend time with their families in spite of what the health officials say, with their families from out of state and with other households. And so we expected a bump. But then there was also this very clear, it's not quite as clear from this graph, but from the growth graph, we'll definitely see that for the United States, there was a clear downward trend in growth rates, a tend towards a peak in the United States as we went into Thanksgiving. And so there was this question of who's going to win. Will Thanksgiving win, or will the momentum that's already pulling the graph downward win? It looks like Thanksgiving kind of won, or sort of won. In any case, we certainly didn't see a peak then, which I think we would have if there had been no Thanksgiving. And now here we are again, really in very much the same place. Just starting to see a tip here, a little bit of a downward hook, a slowing down of that graph. It'll be much clearer in the growth rate graph. And now the question is, who's going to win? The continual downward pressure of the trend on the curve, or the holidays. The winter holidays are definitely going to be a factor pushing this graph even higher. So the United States is one of the worst in this, among these top 20, where you see quite a few of them having peaked in that early December time. If I had to guess, Georgia here and Serbia are maybe what United States would have been if we didn't have Thanksgiving. There was a peak. It was happening somewhere around, it was a little later than the United States, but there was, or maybe this here, Portugal is what United States would have been if there had been no Thanksgiving. We would probably have peaked in early December, and we'd be on the decline now in cases. But for better or worse, there was a Thanksgiving, and we're paying the price in these graphs. And of course, reaping the benefits in human contact and social bonding and all the very important things that cannot be ignored. Anyway, we have to make the same decision coming into the holidays, the upcoming holidays. Will people spend time with their families for Christmas? Maybe I won't. I will be locking myself in a concrete bunker at the center of the earth. And we'll see when I emerge whether the trend has turned downward or upwards. And of course, now there's a vaccine. In fact, now there are 2 vaccines. In fact, I think that soon there will be more vaccines. So all we hear about is Pfizer and Moderna. I have no doubt that the 30 other ones that are in the pipeline, many of them in phase 3, many of them are going to succeed. We probably will see 10 vaccines in the next 3 months, all of them providing millions of doses. And for those who want to get vaccinated or who are forced to get vaccinated, we will see that as a downward pressure as well on this curve. But for now, the news is bad. Lots of countries, even those without Thanksgiving, are just going hog wild in their daily cases per million. Okay, and there's the same for the countries. I am already kind of over time on my countries numbers. Again, you can look at gregfarrar.us if you want to get this, to look at this in more detail or on a region that particularly interests you. This is especially interesting because I don't think I've noticed this crazy number. This is Turkey, yeah. And Turkey was the one that was just whacked. Okay, I'm not quite going to believe this is real. It could be. We've seen things like it, but usually what it means is there was just a whole batch of new cases that were reported on a single day. This happens to some degree everywhere. They'll just get behind in their reporting, and then they catch up all of a sudden, and it looks like they suddenly had 10 times more cases than the day before, when really they were just combining cases from several weeks into a single day's reporting. So maybe Turkey, I'm sure, is not doing great, but it probably isn't doing this badly. So let's ignore Turkey for the moment and look at the growth rates for the hottest countries in daily cases per million. So on this graph, I consider it to be a real problem if it's above 20%. So here's Denmark, which has just, ignoring Turkey, has the worst graph imaginable. I don't think I'll actually say that because I always find that each new month brings things we never imagined were possible the previous month. So one of the worst graphs we've seen so far, though even that's not true. If you look back in the late Octobers, there were a lot of 100%. Here's, for instance, Slovenia, which had over 100% weekly growth rate. These are weekly growth rates. Over 100% doubling of cases every week. That is an outrageous acceleration. But then you can see the light blue trend line. They recovered, and turned the corner around November 11th, and were actually negative in their growth rate for a while, and are now sort of hovering around 0. So this worldwide is not as bad as it was back at the height of this, I would say, Western Europe epicenter that we saw in October. We're actually doing better, for the most part, as a world. The top 20, these 20 at least, have gotten a lot better. These are still the top 20 in daily cases per million, but they've gotten a lot better. But still, we see Denmark, Netherlands, Slovakia. We'll just throw in Panama and Lithuania too, as 5 countries that are seeing more than 20% weekly growth rate. That's an alarming number. And they're rising. These are not, maybe they're starting to peak here, but these are the growth rates, again, not the cases, but the growth. So in order for a country to get over its epidemic, the growth rate has to peak. So we can't have it was 50% last week, and now it's 60% growth, and now it's 70% growth. Eventually we have to at least have it say, all right, it's 50, 50, 50 week over week, and then it has to start dropping. So now we only have 40% more. Now we have 30% more. Finally, it hits 0, as for instance, Slovenia is now. And once it hits 0, then that's when the daily cases growth peaks. That's when we actually start at that point. After that point, we start to see a decline of daily cases. So then we no longer have to say, well, the percentage is dropping. We can actually say the cases are dropping. And we had 10,000 cases last week, and this week we have 9,000 cases, and next week we'll have 8,000 cases. So that's what I call turning the corner. You turn the corner when your growth rate crosses zero, and at that point your daily cases per million curve peaks, starts dropping, and you start to see fewer and fewer cases. And in order to have, in any sense, feel that we're on top of this thing, a country has to at least cross zero. Right now across the United States, and especially in California, we're seeing these situations where the hospitals are full, or at least the ICUs are full, and let's just focus on the United States. The growth rate, though, the U.S. isn't one of those countries I just pointed to. It has a couple of, I'll zoom in a little bit, a couple of positive aspects to its graph, its growth rate graph. One of the positive aspects is that it's dropping. The growth rate used to be 13% a week. Now it's 11% a week. Growth, positive growth, 11% more cases every week than the week before, but dropping. Used to be 13, 14, now it's 11. So that's good. It also is nice that it's not above 20%. So the growth rate of the United States as a whole isn't terrible, but what it doesn't have is a negative growth. And as long as this line stays above zero, as long as the country is growing, we are just going to see more and more cases. That's what it means to be above zero, is we're going to have more and more cases. And this line has been above zero for a long time. Now, it was worse back in November. And here's that drop leading into Thanksgiving, by the way. For my last live stream, I was pointing to how the United States had been dropping sharply in growth rate and saying, well, and here comes Thanksgiving. Is that going to cancel this, or will we actually turn the corner? Well, we didn't turn the corner. Thanksgiving or something came along, and we rapidly reversed course and headed back upwards. Now, the Thanksgiving wave has passed the surge, and now we see that the growth rate has peaked, and now it's starting to drop again. And so we have the same question. Going into the Christmas or winter holidays, are we going to see that winter holiday get-togethers will undo this budding decline, or will it actually manage to continue? And what degree will vaccination help this? Because it will help this. Every time you inject someone with the vaccine, you are very slightly putting a downward pressure on this curve. And we're just barely starting, and we have only enough vaccines for 1% of the population or something. But judiciously applied, we may actually see an almost immediate effect on from these vaccinations, if just the right people are vaccinated. The people who, for instance, medical workers in retirement communities or nursing homes, if those people are vaccinated, which they are, that's their front of the line, then since in some areas 40% of the cases come from nursing homes, and it is, I assume, the movement of the staff from room to room in the nursing facilities that tends to be the spreading, the best spreading opportunity. As long as those healthcare workers get vaccinated, we could see a 40% reduction. It's potentially possible if we vaccinate everyone in the nursing homes, especially the residents, or not especially the residents, especially the staff, but also the residents. If we actually manage to completely do that, then we would see probably a 40% reduction in cases. There are a lot of such people, though, so we won't see that immediately, but we are starting to see that downward pressure. So what are our factors? The trend, this was a peak. The trend is downward. Even long term, the trend is downward. We're still, this recent peak in growth rate is not as high as the last. Thanksgiving threw a wrench into the works, but the trend is still downward. Christmas will throw a wrench into the works. The holidays, all the holidays will throw a wrench into the work, another wrench, and the vaccine will help. So last time I was optimistically predicting that Thanksgiving would not wreck this curve too much. And I think that was overly optimistic. I think the curve is pretty clearly wrecked, but at least it didn't completely regress back to its original peak. But again, as long as this number is above zero, we're continuing to see more and more cases. And that even a mere 10% a week of growth, if you're at capacity, that's a crisis. That's a crisis for the hospitals. And there's a pending crisis for the hospitals. And as we'll see, the United States as a whole is at 10%, but California is much, much worse in its growth rate. Worse than the country now, I think. All right, I've talked a lot about the countries. I've already gone on for 25 minutes about countries, and really, though a lot of it was the United States, I need to move on. So there's lots more to say about the countries, but in summary, Eastern Europe, Balkans is definitely seeing a surge. It's one of the epicenters. The United States is arguably an epicenter. It never seems to quite make number one, but it's certainly been plenty bad. Let's move on to the states. Oh, actually, let's just take one look. If this graph still works, yeah, okay. I always like to take at least a moment to look at the world as a whole. As a whole, the world is growing 0.3% per day. This is a daily change, I think. Yes? I believe this is a daily change. Yes. Yeah, the change in daily cases. So this has been worse, but it's also been better. We've had times when the world was shrinking back in October. The world cases overall were shrinking, and then we had a little bit of a surge. This was the European new epicenter, and things have gotten a little bit better, but we've been hugging zero for a while. 0.3% is not that bad. The world is fairly stable, but it does have to drop below zero, just like on the previous graph, before we can begin to say that we're getting over this thing. Okay. Back to the states, or to the states. States of the United States. Again, I'm not going to be looking at all 50 states, just like I didn't look at all the countries. I only have an hour here. So if you want, you can go to the website, gregfarrar.us, and you can peruse these graphs at your leisure. Couple things. Well, first I'll just start from the top again. Severity, again, 200 is bad. Look at the top 20 states, and you can see that this is even worse than the country's reports, as to be expected. The United States being the sixth worst country right now in severity, I think. We can expect the states also to be very bad and individually to be worse than the countries are as a whole. The very best of our top 20, Alaska, is at 700 daily cases per million. Back when I started doing this thing, it was rare to see 100 or 200, or much above 200. 200 was a pretty impressive and unusual event. Europe never got there, the first wave. Italy and Spain, which seemed so bad at the time, I think that one of them never even reached 100. Now here we are at 700 for our worst. All 20 of these are above 700. And if we look at the graph of all of them together, I think this was also a random blip, so I'm going to just crop Wyoming out of here. Wyoming is not doing that bad. It's right here. I mean, yes, it is actually doing that bad because it's at 500, but it's in the middle of the pack of all the states. Yeah, this is really quite a bad graph. Almost all of them are above 200. So pretty much every state in the United States is a hot spot right now. Now, there is at least sort of a sense of horizontalness to the severity. We're not shooting upwards. Tennessee is, for some reason. Tennessee is extraordinary at 1,800 daily cases per million. But most of the states seem a little bit stable. I'm going to move on to break this down into its components, daily cases per million and growth rates. So, like the countries of the world, this graph looks rather similar to the daily cases per million graph of the countries of the world. It was so much better back when Rhode Island was the worst. I remember those halcyon days when Rhode Island was at 300 and we were saying, "Oh no, isn't Rhode Island such a wave?" And then, was this Arizona? Yep, back in June, when Arizona just blew the doors off all previous numbers and was this ridiculously high. This is probably Florida? No, that's Mississippi. Florida probably has just fallen off this graph entirely. Let's look at the total graph. That'll be Florida, won't it? Yeah. So Arizona, Florida in June and July we'd never seen numbers like that before. Not just above 200, but above 500. Well, look at us today. Those were the days back when 500 was the worst we saw. Briefly, Wyoming almost touched 2,000. South Dakota, which was certainly the epicenter of the epicenter a month ago, reached 1,500. And even now, Tennessee at 11, Rhode Island is back at 1,200. There was a time when I was propounding this theory that once a state had had its wave, it kind of never would again. Well, not really, because there's Rhode Island, one of our worst of the early wave, back again at 1,200. Maybe because CVS is based there, and so they get a whole lot of testing, but it's not all about testing. There really are a huge number of cases, whether you find them or not. So yeah, this is a big, terrible snarl. Almost everyone's above 200. What's the good news here? The bad news is just big, terrible snarl. Everyone's above 200. But let's look at, for instance, South Dakota, North Dakota. Oh, here's something new. Those who've been watching me for a while will remember that my source, coronadatascraper.com, my source for these daily cases, just doesn't report North Dakota. And I've just been saying, well, we'll just look at South Dakota and assume it's the same. Well, coronadatascraper.com has also started reporting no new cases in California. And I will tell you, there have been new cases in the past week in California. So I haven't quite abandoned it, but the data is degrading that comes in from that source. And I've started using the public New York Times data. They're actually, well, they're not volunteers. They're paid to do it. And so I think that the data that I'm getting from their resource is better than the data I get from Corona Data Scraper. So same graphs, different data source, looks much the same, really. There's some weird thing that happened with Massachusetts where they had negative numbers for a while, but maybe they had over-reported and decided to change it to correct over a period. But other than that, the data I've seen has looked pretty good, and we have North Dakota. I'll go to the full graph of everyone here. It still looks about just as bad as it did before. We have just this tremendous surge of cases across every state, pretty much. But we have North Dakota now. So let's look at North Dakota, which was the epicenter in which we just haven't been able to pay attention to recently because of my data problem. This is actually I was going to say it's a really good graph. It's, in a sense, a really good graph. Obviously, the good thing about this graph is that their cases have been sharply declining. From 1,800 daily cases per million, they've declined to 400. Now, recall that 200 is a hot spot, so there's still a hot spot. So that's what's not good about this graph, is just how ridiculously high their numbers have been, but the trend is really, really solid. And so we had this ripple effect where someone dropped a pebble on North Dakota, and it got super high, and then it rippled outwards to the surrounding, Minnesota and then Wisconsin and downward into Montana or over to Montana and Idaho, and it's sort of spreading outward, Colorado and Iowa, and what has happened now is that ripple it feels to me like the ripple reached California and Texas. And so coming from this odd epicenter in North Dakota, it's spread out in concentric rings, and each ring gets it in turn. But North Dakota is now extremely over it compared to how it was back in November. So a month later, North Dakota and South Dakota, by the way, I'm pleased to say that when I was saying we can just treat them as the same, I wasn't just mistaken there. North and South Dakota really do move in lockstep, and both of them were extremely high and have dropped very significantly. So good for them. That bodes well, I think, for California and Texas, who are the new hotspots, because as that ring propagates outward, things get really hot, but then they cool back down. So hopefully California, which is right now extremely hot, will be cooling back down. So that was that epicenter. Let's look at California, though, and Colorado while we're at it, my two states. On Thursday, was in Colorado, and then I flew to California. And this is kind of madness, because Colorado which, again, if you measure the distance from North Dakota, there's some sort of effect there. It's sort of halfway to the ocean from North Dakota, and so it peaked here, and it has declined, not as much as North Dakota, which peaked a little earlier, I think, maybe. In any case, Colorado was very bad at 900, and now it's very bad at 600, but heading in the right direction. California, though, is all out of control. 1,000 daily cases per million is an extraordinary number. California's hospitals, ICUs, are at 100%, and that there's a lag. These are just the reported cases. When you get reported cases, then a week later you get the hospitalizations, and another week later or so you get the deaths. And so until we reach a peak here, there's this inevitable, inexorable force that's going to be driving our hospitalizations up in the coming week or two, and is going to be driving our deaths up in the coming couple weeks. And then there are the holidays. So this is just, I'm literally in a basement here in California, not even mostly interacting with members of my household, because we have it about as bad as anyone right now. California is one of the very worst. And this graph does not show a lot of good trends to it. Well, look at the growth graph. I think the growth graph, always my favorite graph, because it does tend to point towards the future in a way that cannot be easily seen from this graph. I think the growth graph has some good news for California, but only a little. But this graph, obviously, good news for Colorado. Look at a few of our favorites. Georgia, not looking good. Georgia, rising, no sign of that changing. Our favorites are just the ones that listeners and family live in. Louisiana, not looking good. Louisiana, a lot like Georgia, really. A lot like Georgia. Amazing how closely those curves track. Louisiana rising, not as bad as California, not anywhere near as bad as California, but maybe it's the beginning of a peak there for Louisiana. Ohio briefly. Yeah, Ohio has had a really high peak and very recently has been showing a decline. So I'm not going to do much on that. I'm not going to believe much about Ohio yet. Texas, actually very similar. Let me look at Texas and Ohio. Not that similar. But Texas, broadly, it is rising. It certainly has a nice shooting downward in the past few days, but that's not enough days to say anything. You know, it did the same thing around here and didn't keep it. It dropped here and didn't keep it. So we don't know. The broad medium trend, the average trend is upwards in Texas. Maybe just the slightest sign that it might be getting better there. Where else? Anywhere else? Just throw in Florida. Florida? Hello? Florida. Yeah, Florida, which was one of that back in the days of Arizona and Florida, when they were the worst. They got so much better. They weren't even hot spots. It wasn't even a warm spot. It was under 100 DCPM. And now everything's gone to hell again. Florida back up to 500, about as bad as it was at its previous peak, though not in the worst overall. We have so many bad ones, bad states now. Florida is so, but still a very hot spot. And then Arizona, which is right up there with the worst ones at 1,000. 200, recall, is hot. That's a hot spot. I need a new term, white hot spot. Blazing center of the sun, hot spot. And there's nothing particular to say that we can't start seeing 10,000 be normal. The whole segment that I did on the 1918 flu or on the Black Death back in March or whenever I was doing some comparisons to historical epidemics. This is a really mild epidemic compared to either of those. Just for context, we have a fatality rate of 1% versus 50% for Black Death. Just imagine everyone in your or half of the people in your town dying in a matter of weeks. That's the Black Death. So to get a little perspective, things could be a lot worse, and it's possible that they will get a lot worse. I don't really see this thing changing into a 50% mortality pandemic. That's just not the way that coronaviruses, well, I guess I shouldn't say that because we've got SARS and MERS, which certainly were very high mortality. So let's just hope not, shall we? Let's hope that if there is a mutation that makes it much more dangerous, that mutation will also do what such things do and kill off its host so quickly that they can't spread it. That's usually what happens. What's happened with the original SARS and with MERS. This thing's called SARS-V2 for a reason. It is the 2.0 release of the virus, and it has super spreader potential because it doesn't kill its hosts. It has them asymptomatically go to Christmas parties instead. All right. And by the way, just to touch on some news, you may have heard it. There's, I would say, panic around this new variant of the virus in southeastern Britain and in London. Maybe this thing really is 70% as infectious as the old one, which would mean more cases. But the data isn't in on that, so just everyone calm down for a little bit. All we know is that the virus is more prevalent, and one possible explanation of that is that it's more infectious. But it's also, there are other possible explanations, like it was part of a super spreader event. So data's not in on that. And even if that does turn out to be true, the evidence does not suggest that particular new strain is any more lethal. So we may end up with more people and more hospital overload already than we have, but we won't see 10% of its victims dying or 50% like we have seen in some cases, epidemics in the past. We have a relatively benign virus this time. Okay, looking at percents. Weekly percent growth by state. Let's look at the top 20 because it'll be a little easier to see. This is where we start to see at least a little bit of goodish news. Goodish news. So, this again is the growth by week. These are the top 20 states in daily cases per million. So the hottest states in terms of number of cases, how are they growing? Well, the good news here is that this graph is relatively horizontal rather than upward. If it were upward, then all these really hot states would be growing faster and faster. The bad news is that it's no longer downward the way it was leading into Thanksgiving. So leading into Thanksgiving, we saw these nice trend where all of them were up in the 20, 30, 40% range, and then suddenly they were heading down into the 10% range maybe on average, and then it kind of lost it. In some of these, you can see a few of these strands here, like Alabama, Pennsylvania, Mississippi, Connecticut, Rhode Island. Those started heading upwards. And then, so that was that Thanksgiving bump. Now, on the bright side, somewhere around December 13th, all of these turned backwards, downward. So the growth is slowing in all of those cases. And plus, it's certainly worth noting, there are a lot of these that are below zero. All of these are seeing shrinking cases. New Mexico, Wisconsin, Alaska, Montana, South Dakota, Nebraska, Wyoming. We saw South Dakota already really looking quite good. This purple line has been below zero for a long time, which means that we're having fewer and fewer cases each week. And that's why that graph is sharply downward in total cases. Fewer and fewer cases each week means that the cases graph is dropping. So good news, where a lot of the top 20 are actually actively shrinking. Maybe 5 of them that were growing in growth rate. They're still growing in daily cases because they're above zero, but their growth rates are shrinking. So that's good. They're heading towards, like Rhode Island here, if it continues, it's going to cross zero on the 20th, and it'll start shrinking on the 20th, just in time for the holidays. Where's California? I keep expecting to see it here. Oh, I know. It's because this is Corona data scraper data. Let's move on to the New York Times version of this. I should probably just get rid of those. New York Times does give in fact, a substantially different graph than that. So it's not fundamentally different, but a lot more lot more states, according to the New York Times data, showed a rise around Thanksgiving, and almost all of them are showing a drop now. Again, I trust this data more than Corona Data Scraper. And so we see still the same idea that quite a few are shrinking, a lot of them are growing, almost nothing's growing more than 20%. The only ones that are California and Tennessee, and of the ones that are in the less than 20% range, almost universally they're dropping. And so we see that a few days from now, maybe a week from now, if there were no forces pushing this graph upwards, we could expect reasonably all of these states to have turned the corner towards negative growth. All of them would have peaked in their DCPM reports. We'd see fewer and fewer cases in all of these hardest hit states, except for really the sole exceptions, Tennessee and California. We'll talk about California specifically in a minute because it's, as you can see, in a world of its own, more or less. Now, Tennessee is even more in a world of its own. It's the only really bad graph here that has only really bad line on this graph is Tennessee, which has an extremely high growth rate of 55% per week, and it's accelerating. So Tennessee is in a remarkably bad place, which is really surprising. Normally the states kind of tend to move in clumps, but somehow Tennessee has broken away and is having its own epidemic adventure without the rest of us. So I'm glad I'm not in Tennessee, but unfortunately I am in California, and I wish I weren't, because this is a really pretty bad graph as well. 40% growth rate, that's a really high growth rate. The good thing, the only good thing here is that it's a lot better than it used to be. December 12th, California's weekly growth rate was at 64%. Now it's declined and it's at 40%. So 50% reduction or so of growth rate. That's something. And if it were to continue, if there were no forces on this graph pushing it upwards, California could reasonably expected, since from the 12th to in about a week, it's dropped 20%. It would hit zero probably in about 2 weeks, and we would see California peak and the cases start to drop. However, there are forces pushing this graph upward, and those forces are the holiday season. And this upward trend, which broke the downward trend we were seeing, I think we can argue is entirely Thanksgiving. We don't know for sure. We'll never know for sure. But there's a good argument to be made that Thanksgiving was, in fact, a lot worse on the California COVID trend than it was on the country as a whole. You may recall from the previous segment that the country was very high, and then it dropped downward for a while, and then Thanksgiving came and brought its growth rate back up, but not as high as it had been. That is not the case with California. Before Thanksgiving, it had a high, very high, 50% growth rate. It dropped down to an almost tolerable 17% growth rate. And then the Thanksgiving surge pushed it up to 65%, 64%, even higher than it ever was before. So when you see these kinds of numbers where day after day the growth rate is over 20%, with the exception of this tiny section here, that leads to the sort of curve we see for California, which is just up, 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 up. Again, the good news is there's a downward trend. There's clearly some sort of pressure, whether that's, I would tend to say it's fear. It is the power of fear that has me in this basement and wearing a mask around my own housemates. The power of fear has me sitting off in the farthest corner of the airport, though it didn't stop me from flying. But in any case, I think the Californians have known that there was a problem back in November, and they probably just started doing a lot of the things, staying away from each other, many of them not doing Thanksgiving, wearing masks, and all the things that help this graph, as far as we know. But then probably some of them did, some percentage, enough of a percentage did meet with other households and had parties for Thanksgiving, and that probably led to this surge. And maybe it's because Californians as a whole have felt that that we were kind of immune in a sense. California has never had it very bad, and so there may have been some complacency among Californians that we never really were a hot spot. Everyone else was a hot spot. We were never great, but we were never a hot spot. And so maybe we let down our guard, and that happening right about Thanksgiving may be what happened here. So that's California. Not very good news for California. Colorado's growth, on the other hand, is negative 20%. I'm going to zoom in a little bit here so we can just see recent months. Colorado, which had it quite bad a month ago, has been getting steadily better and is seeing nice negative growth rates. Louisiana also had a real spike of growth, but is at least down to 0 now. So Louisiana has been wavering around a lot, but it's doing pretty well. Drop a message in the chat if you want me to focus on your state. Let's see, Texas, not so good. It's in the realm of California, really. Texas has generally been better than California recently, but even had a period of actual shrinkage of cases for 4 days. But now it's back up into the 40%, 30% range, which is really a very high number. Don't like to see that. What else? Maybe look at Ohio. The sharpness and angle of this makes me suspect the data a little bit. We don't usually see such straight lines. So there probably was a sudden spike of reporting here or something like that. But if the numbers are to be believed, Ohio isn't doing too terribly. It's growing by 5%. Everybody's growing, but Ohio is better than some. Okay, this is obviously gonna be a longer than usual one, but I'm gonna move on. Those are the states. Next section will be on the counties of California. Just to summarize it's just, things are in a bad place now. The countries, we still have multiple epicenters around the world. The United States is in a particularly bad place compared to the rest of the world. California is in a particularly bad place compared to the rest of the states. We do see these signs that the epidemic is receding on its own, but then we see Thanksgiving coming and ruining everything. I hold out hope that the vaccine will solve all this in the next 6 months and maybe start to have an effect right now. But without it, I guess what I do hope will happen, what I think is plausible, is that we'll see a rise across the country over the holidays, similar to what we saw for Thanksgiving. So and we're going to see some real disaster scenarios in hospitals around the country. I just don't think that's avoidable at this point, especially in California. There are going to be no elective surgeries for a while. So if you were hoping to get that elective surgery, you missed your window. And there's going to be not enough nurses and not enough healthcare to care for the sick for weeks to come, but probably not months and months to come. That after the holiday surge, it will start to drop, as we keep seeing. And I don't foresee another Thanksgiving or Christmas. Maybe when Easter comes around, we might see something like that. But I think we actually may finally see this trend, which has been trying so hard to drive us back to zero growth and got interrupted by Thanksgiving, and is now trying very hard to see it back to zero growth, and will probably get interrupted by Christmas. Hopefully this trend will continue after the winter holidays, and we will finally see California and the country peak maybe in January. That seems plausible, but predictions are, what is it? Someone said making predictions is difficult, especially about the future, something like that. My predictions have not been particularly reliable. The one thing that I can predict is when a state or a region is peaking and when it's going to start seeing dropping cases, but that's a short-term prediction, and none of those are really happening right now. There aren't very many places that are peaking. The United States is not peaking right now. So yeah, the news is still broadly bad, but those are the facts. That's what they actually are, and I'll keep reporting them as I see them. I'll move now on to the counties of California. So, counties of California in severity, every time we zoom in further, these severity graphs just get worse. In the countries, I'll flip back there for a minute. In the countries, the severity report was showing all these numbers in the 500 to 1,000 range, and I was saying that's really high because 200 is a hot spot. And then among the states, all these states were showing numbers in the 1,000 to 1,500 range, or around the 1,000. And I was saying, well, that's really high because 200 is a hot spot. Well, now here we are in California, and the top 20 states, the lowest of them is at 1,000. And so we're seeing numbers in the 1,000 to 4,000 in severity. And that's really hot. If you look back in history, you do see there have been a few cases. We have Imperial and Kings, we recall from June, were really bad. And Stanislaus, there's Stanislaus. A couple of these may have just been data anomalies, but these were real. The prison population in Kings and the transfer of back and forth for healthcare across the Mexican border and Imperial seemed to have caused some extreme spikes back then. But now everyone's getting in on the act. I'm going to zoom in on this a little bit. This is no longer just the royal couple here of Imperial and Kings. We've got kind of everyone. We have 20 different counties in California, all looking terrible in terms of severity, especially San Bernardino, Imperial, again, and Riverside. Riverside is just miserable, and all of these are. They're at 3,500 daily cases per million. I'm just open-mouthed in astonishment and horror at some of these numbers. We haven't seen this before much. So yeah, that's why California is looking so terrible, is especially certain counties. Los Angeles looking none too good at 2,300, though that almost looks reasonable next to the 3,500s we were just talking about. But 200 is a hot spot. This thing has got it beat by a factor of 10. Fresno is shooting upwards. Kern at 2,000. All of these are really bad. These numbers are all just very high infection rates. And not much of a sense, just eyeballing, squinting at the chart, not much of a sense that these are dropping away. They all seem to be headed upwards. All right, I don't have much time here. I'm just gonna head to the growth just to see, because often the growth chart shows us some sort of happiness, and I do like my happiness. So if we look at the growth chart for the top 20, I immediately notice Fresno, which is growing at a rate of 76% a week, very high rate, and shooting upwards. On the bright side, we aren't seeing some of these multi-100% growth rates that we've seen. At least no one's growing more than 100% a week. So that's something, and there's a sense of horizontalness to most of this. A lot of these are holding steady. One of the worst ones, Riverside, has actually declined from 94% to 73. 73 is really terrible, but 94 is worse. So, okay. We even see Kings apparently turning the corner now towards crossing that zero line and heading towards negative growth. So, Sutter, Yuba, Merced, all of these are slight rays of hope in a dark, dark graph. Some of these are trending downward in their growth rates. If we look at the counties as a whole, it's actually hard to see with so many in such a snarl. But I would say there are a number of counties that are trending downward in their growth rate, and we would expect this. Popping back to the California growth rate based on New York Times numbers. New York Times growth rates are here. Looking back at the California growth rates, California as a whole used to be growing at 64%, and now it's growing at 40%, as we mentioned in the last segment. And so that can only happen if, on the whole, counties are dropping in growth rate, not in cases. No one's dropping in cases. Every one of these 20 is above that zero line. Actually, this is even 20. This is everyone. I don't see any county. Are there any of them? No, this is a Corona. Oh, never mind. Corona data scraper number. We don't have New York Times county level information, so we'll just have to take what we get from Corona data scraper. But I don't see a single county that's below zero in growth rate right now. They're all growing, but some of them, like Kings and Nevada, are at least almost ready to hit zero. And there's definitely a sense that quite a few of these are headed towards zero. But then a lot of them are horizontal and a few of them are up. So it's a mixed bag, but mostly heading in the good direction. However, here come the winter holidays. And as I keep saying, that's I think, bound to hit the numbers. The winter holidays we're gonna see an upswing most likely. We certainly did for Thanksgiving. On the other hand, here comes the vaccine. So maybe those two will cancel each other out. I don't know. I'm not even making a prediction on this one because we still have at least three factors. We have the general downward trend. We have the upward pressure of the winter holidays, and we have the downward pressure of the vaccine. And I don't know who's going to win, but I will certainly be doing another one of these then in a week or two. Really what I should do is, if nothing else, do 2 weeks after the holidays so we can see what happened. Because as we see now, 2 weeks after Thanksgiving, we see what happened. It wasn't pretty, but it wasn't as bad as it could have been worse. All right, I guess I'm going to stop there. The virus is at large. Be safe, be careful, wear masks, try not to hang out with people that aren't in your household. All these things help. I recommend getting vaccinated when you can, but I know that most of us can't. If you don't get vaccinated, hang out with people who do. Maybe they'll protect you. Get tested. Yeah, and just hang in there because brighter times are coming for sure. Brighter times are coming. The vaccine will pretty much guarantee that. Brighter times are coming. Hang in there. Hard times. I'm Greg Farrar. Thanks for watching.